Hello everyone, welcome to my channel.
Did you know that heart attacks are one of the leading causes of death worldwide? Indeed, it's a silent epidemic that stealthily claims lives across the globe, affecting millions of people every year. Heart attacks, also known as myocardial infarctions, occur when the blood supply to part of the heart muscle is blocked, often by a blood clot. This can seriously damage the heart muscle and can be fatal. The silence of this epidemic lies not in its absence of signs or symptoms, but in our collective failure to recognize and respond to them. So, why is it important to understand heart attacks? Simply put, knowledge is power. Knowing the risk factors and preventive measures for heart attacks could save your life or the life of someone you love. Some of the common risk factors include high blood pressure, high cholesterol, obesity, diabetes, and a family history of heart disease. But remember, these risk factors are not a death sentence. With the right lifestyle changes and medical treatment, it's possible to significantly reduce your risk of having a heart attack. Prevention, they say, is better than cure. And when it comes to heart attacks, this couldn't be truer. Preventive measures include maintaining a healthy weight, eating a balanced diet, exercising regularly, not smoking, and limiting alcohol intake. It's also crucial to manage stress and get regular health checkups. And finally, let's not forget the importance of early detection and prompt medical intervention. If you or someone else experiences symptoms of a heart attack, such as chest pain, shortness of breath, or discomfort in the arms, back, neck, jaw, or stomach, seek immediate medical attention. Every second counts when it comes to surviving and recovering from a heart attack. With these shocking statistics, it's clear that heart attacks are a global health issue that we cannot ignore. But remember, knowledge is our greatest weapon in this fight. Let's use it to protect ourselves and our loved ones from the silent epidemic of heart attacks. But what exactly is a heart attack and why does it happen? A heart attack, also known as a myocardial infarction, occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off entirely. This happens because the coronary arteries that supply the heart with blood can slowly become narrower from a buildup of fat, cholesterol, and other substances. This process is known as atherosclerosis. If a plaque in an artery ruptures, a blood clot can form around the plaque, blocking the blood flow. Now, you may wonder, what causes atherosclerosis? Well, it's a mix of factors, some of which we can control and others, unfortunately, we can't. Let's talk about diet first. Consuming foods high in saturated fats, trans fats, and cholesterol can raise blood cholesterol levels. This cholesterol can deposit on the walls of your arteries, narrowing them over time. And then there's lifestyle. Lack of physical activity can contribute to heart disease by promoting obesity and high blood pressure. Smoking too plays a significant role. It damages the lining of your arteries, leading to a buildup of fatty material, which narrows the artery. Genetics also play a part in heart health. If your parents had heart disease, especially at a young age, your risk of developing it is higher. But it's not all doom and gloom. While we can't change our genes, we can certainly influence our diet and lifestyle. Eating a balanced diet, exercising regularly, and avoiding smoking can go a long way in maintaining a healthy heart. So, stress, unhealthy diet, lack of exercise, smoking, and genetics are all pieces of the puzzle that can lead to a heart attack. As you can see, heart attacks are often the result of a complex interplay between various factors. Up next, we'll delve into practical tips to keep your heart healthy and reduce your risk of heart attacks. So stay tuned. So, what can we do to reduce our chances of experiencing a heart attack? Let's start with diet and exercise. Eating a balanced diet is a cornerstone for good health, and it plays an essential role in protecting your heart. It's vital to fill your plate with a variety of foods that provide the nutrients your body needs. Think of fruits and vegetables, whole grains, lean proteins, and healthy fats. These foods not only nourish your body, but also keep your heart in good shape. However, a heart-healthy diet isn't just about what you eat, but also what you should avoid. Sodium, for instance, is a common ingredient that can raise your blood pressure, increasing your risk of heart disease. It's often hidden in processed foods, so read labels carefully and aim to consume less than 1 teaspoon of salt per day. Now let's talk about fats. there's a common misconception that all fats are bad, but that's not entirely true. While it's crucial to limit saturated and trans fats, unsaturated fats found in foods like avocados, nuts, and olive oil can actually help lower your cholesterol levels. Moving on to exercise, it's no secret that an active lifestyle can do wonders for your heart, but you don't have to run a marathon or lift heavy weights. Moderate physical activity, such as a brisk walk, swimming, or even gardening for about 30 minutes a day, can significantly improve your heart health. Remember, consistency is key. It's better to do a little bit every day than to do a lot at once and then stop. And of course, always listen to your body. If you feel pain or discomfort during exercise, take a break and consult a healthcare professional. By making these changes to your diet and exercise routine, you can significantly reduce your risk of heart disease. Remember, your heart is the engine that powers your body. Take care of it and it will take care of you. But diet and exercise are just part of the equation. Let's look at the other lifestyle changes you can make. Now, if there's smoke, there's fire. And in the case of heart health, if there's smoke, there's a higher risk of heart disease. Smoking is one of the leading causes of heart disease, and quitting can do wonders for your heart. It's not easy, but there are resources available to help. From nicotine patches to support groups, there's a quitting method that can work for you. Alcohol is another factor to consider. While moderate drinking can have some health benefits, excessive alcohol consumption can raise your blood pressure, contribute to obesity, and lead to heart failure. It's all about balance. Limiting your alcohol intake to a moderate level, which is typically defined as up to 1 drink a day for women and up to 2 drinks a day for men, can help you keep your heart healthy. And let's not forget about stress. Chronic stress can increase your heart rate and blood pressure, potentially leading to heart disease. But managing stress is easier said than done, right? Well, there are practical steps you can take. Regular exercise can help reduce stress, as can mindfulness practices like meditation and deep breathing. Even something as simple as taking a few moments to relax and unwind each day can make a difference. In fact, you can start right now. Take a deep breath in and let it out slowly. Repeat this a few times, and you might just feel a little bit calmer. This is just one of the many ways you can actively manage stress in your everyday life. And remember, it's not about making all these changes overnight. It's about making small, sustainable changes that you can stick with. Whether it's swapping out a cigarette for a nicotine patch, choosing a glass of water over an extra glass of wine, or taking a few minutes each day to practice mindfulness, every little bit helps. Remember, every step you take towards a healthier lifestyle is a step away from the risk of a heart attack. Now, even with the best lifestyle habits, it's essential to keep an eye on your heart health through regular checkups. In the journey to a heart-healthy life, there's a co-pilot we often overlook: preventative healthcare. It's not just about reacting to issues as they arise, but it's about staying one step ahead, detecting potential problems before they become life-threatening. Regular medical checkups play a crucial role in this process. They provide a comprehensive snapshot of our health, allowing doctors to detect subtle changes that could signal the onset of heart disease. These checkups often include blood tests, blood pressure measurements, and other diagnostic tests that give insights into our heart health. Early detection is synonymous with a better prognosis. Identifying heart disease in its initial stages can dramatically increase the chances of successful treatment. It's like finding a small leak in a boat. The sooner you spot it, the easier it is to fix, and the less likely you are to sink. Regular checkups also give us the opportunity to discuss any concerns or symptoms with our healthcare provider. Maybe you've noticed shortness of breath during your morning jog, or perhaps you've been feeling more fatigued than usual. These could be early signs of heart disease that shouldn't be overlooked. Moreover, these checkups are a great time to review your lifestyle habits with your doctor. They can provide personalized advice on diet, exercise, stress management, and other factors that can impact your heart health. Preventative healthcare is not just about catching disease early, it's about empowerment. It's about understanding your body, knowing what's normal for you, and recognizing when something changes. It's about taking control of your health and making informed decisions that protect your heart. So, Don't wait for signs of trouble to take action. Be proactive. Make regular checkups a part of your health routine. Remember, it's not just about adding years to your life, but also life to your years. Regular checkups and early detection are our best defense against heart disease. In conclusion, heart attacks are a prevalent global health issue, but there are many steps we can take to reduce our risk. Let's revisit some of the essential points we've covered in this video. We've learned that heart attacks, while common, are not inevitable. With proper care and lifestyle changes, we can significantly reduce our risk. A heart-healthy diet is one of the most effective tools at our disposal. Incorporating fruits, vegetables, whole grains, and lean proteins into our meals can help keep our hearts strong. On the flip side, limiting our intake of saturated fats, trans fats, and cholesterol can prevent the buildup of plaques in our arteries, a major cause of heart attacks. Regular exercise is another cornerstone of heart health. A moderate intensity workout for at least 30 minutes a day, 5 days a week can go a long way in keeping our hearts in top condition. Remember, it's not about the intensity of the workout, but the consistency. We also discussed the importance of lifestyle changes. Smoking and excessive alcohol consumption are two major factors that contribute to heart disease. By quitting smoking and moderating our alcohol intake, we can significantly improve our heart health. Stress management too is a critical component in preventing heart attacks. Stress can lead to high blood pressure, another risk factor for heart disease. Hence, it's vital to find healthy ways to cope with stress, be it through yoga, meditation, or simply taking time out to relax. Lastly, regular checkups and early detection cannot be emphasized enough. Routine screenings can help identify any potential heart issues before they become serious. Remember, early detection is key. The sooner a problem is identified, the better the chances of successfully managing or even reversing it. As we wrap up, let's remember that our heart health is largely in our own hands. By making these changes, we're not just preventing heart attacks, we're also improving our overall health and quality of life. Remember, your heart is in your hands. Take care of it, and it will take care of you.